Long COVID. Patients may unlock secrets of mysterious conditions. In a room at M Health Fairview in Minneapolis, Minnesota, Anna Marie Riefer stepped onto a treadmill. Hooked up to gadgets to monitor her heart rate, blood pressure, and other vital signs, Riefer starts off slowly. Over the course of several minutes, physical therapist Cassandra Anderson increased Riefer's speed and incline, constantly checking in to see if it was too much, too fast. Together, the two of them are trying to figure out her optimal heart rate for exercise to prevent the spiral into periods of fatigue. Start exercise, even yard work, with a slow 5-minute walk, Anderson advised. Then slowly ramp up the intensity of your exercise, and when you hit that heart rate zone, then start slowly ramping down the exercise. Physical therapy is just one aspect of Riefer's treatment for post-acute sequelae of COVID-19, otherwise known as long COVID, which is a constellation of symptoms like profound fatigue, shortness of breath, brain fog, and headaches. The symptoms that have lingered since Riefer fell ill with the virus last fall. No one really knows why some people develop these long-term symptoms. Doctors are still studying long COVID, but they hope to gain a better understanding of conditions that have vexed doctors for years. Mild cases, long-lasting symptoms. Riefer is among a growing number of people who had relatively mild cases of COVID-19, only to experience long-lasting symptoms. Work, exercise, and even riding her motorcycle is difficult for Riefer, who says she was very active before getting sick. I'm a type A personality, never stops, out mowing the lawn, running around with my teenage kids, swimming, going to the gym. Post-COVID, when Riefer overdoes it, she said she crashes hard, and sometimes for days. A crash is full on. I can't keep my eyes open. My body is just exhausted. And I need a nap, and I need it right now. As a trained nurse serving as a patient care supervisor in one of M Health Fairview's pediatric departments, Riefer is uniquely qualified to identify and understand when something is wrong with her body. But that didn't make it easier to admit she was struggling with post-COVID symptoms. After being out of work for 3 weeks, including several trips to the emergency room for shortness of breath, she still wasn't feeling better after her COVID diagnosis in late October of 2020. Riefer said she was in denial that she was still ill. It's just hard to admit that you're not at 100%, she said. It wasn't until this spring that her primary care physician suggested she work with the post-COVID clinic. Even my staff didn't know about how much I was struggling until the last couple weeks. Dr. Leslie Morse, head of rehabilitation medicine for M Health Fairview, participates on Riefer's care team. Her hospital opened a clinic that brings together different disciplines to treat people like Riefer, who is fairly typical of the patients seen there. Her initial symptoms were asthma-like symptoms, followed by shortness of breath that really persisted and severe exhaustion. At mHealth Fairview, Morse said research suggests that women are at slightly higher risk of developing symptoms, as are people who had other conditions like heart or lung disease. A similar evaluation from Mayo Clinic, which operates its own long COVID clinic, found that most patients seen there didn't have pre-existing conditions. Morse said, knowing that reefer and thousands of other long COVID experience symptoms following a viral infection unleashes new insights. With so many people worldwide developing so many symptoms that are really reflective of chronic fatigue, fibromyalgia, all of these conditions that are understudied, not well understood, I think it's going to drive a lot of research, she said. Medical mysteries. A massive research funding effort from the National Institutes of Health to better understand long COVID may help drive new discoveries. Morse said funding can be scarce for other chronic conditions. Take postural orthostatic tachycardia syndrome, or POTS. The syndrome, marked by low blood flow and a rapid increase in heart rate, intrigues Dr. Hannah Askelrod, an infectious disease expert at George Washington University School of Medicine in Washington, D.C., who leads the institution's COVID-19 recovery clinic. POTS has been a bit of a medical mystery as to why certain people develop it and what it triggers, she said. Before COVID, not many POTS cases were documented. Askelrod said doctors didn't always know how to help patients. But in the last year, a high number of people contracting COVID-19 have gone on to develop POTS. So we do think something about COVID-19, whether it's the severe inflammation this virus can trigger, possibly its effects on the neurologic system that breaks this normal regulation between the demands on your heart and vascular system and what they actually do, Askelrod said. But Askelrod said, long COVID teaches doctors to listen more carefully to patients who say they have nebulous and hard-to-define conditions like brain fog and chronic fatigue syndrome. I think we're also seeing the value of listening to our patients and hearing them out, she said. Doctors are trained to prioritize conditions that can be fixed on the spot or things that require hospitalization, Askelrod explained, but may not be as well versed in certain chronic conditions. A viral trigger. Dr. Peter Rowe directs the Chronic Fatigue Syndrome Clinic at Johns Hopkins Children's Center. For more than 2 decades, he's seen kids who have debilitating fatigue, headaches, and cognitive issues, similar to what other doctors are seeing in post-COVID patients. Rowe said that in his experience, it appears symptoms can be triggered by having a viral infection. More than 60% of kids who come to him develop symptoms after having mononucleosis. With all this creative thinking being brought to bear on long COVID, somebody is going to come up with interventions that may be very helpful to the people who've been struggling for years and decades with chronic fatigue syndrome, he said. There are lessons from treating chronic fatigue syndrome that may translate to treating COVID-19. For instance, Rowe said that for a long time, the perception in the medical field was that the symptoms were psychosomatic. They must have school phobia, or they don't want to do things, or they're responding to stress, he said. Cognitive behavioral therapy and more rigorous exercise were common treatments. But those approaches haven't worked, and in some cases, made things worse. We also hope that the knowledge flow goes in both directions and that people won't make the same mistakes with post-COVID patients that they made with pushing chronic fatigue patients too hard physically before they were ready. At her therapy session, Anna Marie Reefer gets a game plan for how often and how rigorously to exercise in the coming weeks. She will be seeing her occupational therapist too to work on breathing exercises. Reefer already sees improvement in her symptoms. She still crashes, but not for days like before. Now, to only crash for 24 hours is actually an improvement for me, she said. Reefer said she's taking it slow and steady to be closer to normal for her son's marching band season this fall.